You're listening to Body by Poly. I'm Dr. Alain Polynice, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results.
Have you avoided taking your shirt off at the pool or the locker room? I've had patients come in say they haven't taken their shirt off for years because they're self-conscious about the excess tissue along the chest area, excess breast tissue. So what causes gynecomastia, which is essentially an overdevelopment of male breast tissue? That happens during puberty. Everybody goes through puberty and you have overdevelopment of the breast tissue, but that typically goes away. But in some cases, it persists. There are other things that can cause it, certain medications, such as finasteride, that the men take a lot, or obviously steroid use, that can do it, or marijuana use. All of those things can affect hormones in the body and can create excess formation of breast tissue. Now, gynecomastia comes in 4 grades, grade 1 through 4, 1 being the mildest form, 2 more pronounced, and all the way to grade 4, where you have not only overdevelopment of breast tissue, but drooping or ptosis of the actual breast itself. And one other factor that's more common these days is the use of GLP-1 medications like Ozempic. So the rapid weight loss can also affect how the tissue of the chest behaves, and that can accentuate or worsen gynecomastia. So obviously there are surgical options. If it's a mild grade, sometimes just liposuction of the chest area could help, but liposuction alone will not remove the actual breast tissue itself. So a combination of liposuction of the chest and also making a small incision right under the areola, that can allow us access to remove that excess breast tissue. And it's very rare for men to have breast cancer, but it can happen. So any breast tissue that I remove, I do send to the lab for analysis. Then you get into the more pronounced grades, grade 3 or grade 4. So that may require not only liposuction and removal of the breast tissue, but also a breast lift to tighten up the skin envelope. So if you're thinking about doing this type of surgery, if you have concerns about the chest area, or if any of what I said resonates with you, then you definitely should get a consultation to discuss the options, because there are surgical options and you don't have to keep your shirt on forever.
Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.